Can you expand on the difference between the rheumatoid arthritis and the osteoarthritis you just described?
Rheumatoid arthritis, there's a genetic component to it, but there's also a viral component to it. In other words, if you have a viral infection of some kind, it can trigger rheumatoid arthritis. And we were guessing at that before. We had an inclination. After COVID-19, we now know it can trigger rheumatoid arthritis. And we've seen a major increase in rheumatoid patients and their symptoms, et cetera. So the rheumatoid arthritis is an inflammatory response that directly attacks the cartilage. And with that, there's some very key patterns. In other words, your wrist starts to get the arthritis and it starts to subluxate this direction. So the whole wrist shifts this way. And when it does that, it starts to pull your tendons. So your joints go into ulnar drift and then go into flexion and dislocate volarly. So then you get this funny pattern that's rheumatoid arthritis, which can then go into this kind of a deformity with boutonniere deformities or swan neck deformities, and which is like that. And that's all because of the loss of the joint structures that stabilize those joints, and that is the ligaments and the capsule around, in addition to the cartilage, and then all the muscles getting tight and everything shifting. Whereas osteoarthritis, it's also got a genetic component to it. I blame the Scandinavians traveling all over. You can track their migration patterns through this arthritis pattern. And because it's both these knobs here, the knobs on your joints are forming because your cartilage is thinning. And when it thins, the joint then rocks back and forth. And so when it rocks, Mother Nature does not like instability. So she makes these extra knots here on the side to make the ligaments now have tension and stabilize out. And so that's what those are. And that truly is hereditary, and you can't really stop it. It's on the march. It's going to do its thing. Psoriatic arthritis is another variety of rheumatoid arthritis, but it only really attacks out here at the distal interphalangeal joints. And you can also have psoriatic skin issues, but that doesn't necessarily you always do. You can have the arthritis without the psoriasis and the skin patches. So for the osteoarthritis, I will tell people, please just wear a Band-Aid and use like Voltaren or Medica or any of these anti-inflammatory agents. The Band-Aid will increase the strength of that joint 2 times. And we know this from the biomechanics lab. We know that if you just take a Publix brown paper bag and wrap it around the tibia, you will increase the strength of that tibia 2 times. So we don't need anything fancy. So just the Band-Aid is enough. Wear that at night. Wear it when you're typing and writing if you're having a bad day. So those things will help with that arthritis, and that's the difference. Rheumatoid is a whole nother ballgame. We're chasing that, but fortunately, we've got the biologics. This is where you want to get hooked into a rheumatologist. And I always tell my patients before we even embark on surgical options, are you doing any of the IV treatments or other treatments that the rheumatologists have first? Do that first, because we've really dropped the number of these cases that we see because of that. So that's the good news. There's a lot of ways around to avoid surgery now.